don't worry. There's hope for the hopeless. Dr. Charles Martin is here with us this morning to explain what in the world that means. Hope for the hopeless?
Yes.
Really?
Yeah. Well,
Okay.
a lot of people feel like their mouth is so bad that they're embarrassed to go. They're embarrassed to even call. They're embarrassed for a dentist to see them. And reality is that, our office is designed to help the person who has big problems, who've been embarrassed by the way they look, that don't like the way they look, and frankly, they've gotten themselves in a bad position.
So how often do you get people come to you and they say, I was going to come, but it was just so bad. Mine has got to be the worst you've ever seen, Dr. Martin. You hear that a lot?
Daily.
Yeah.
I'm the worst you've ever seen.
And they're not the worst you've ever seen.
No, of course not.
Yeah.
And virtually everyone can be helped. People call us and they'll have stories and they'll actually sometimes be in tears on the phone about all they've experienced. And we know that since 75% of the populations have had some kind of experience that they didn't like at the dentist, we designed the office so they can have a positive experience.
Okay. All right, let's talk about if everybody benefits from getting their teeth fixed and have a beautiful smile and the teeth work done, then why the hesitation? What's the holdup?
The hesitation is I had a bad experience as when I was a child, and it remains with them. I have grown men who come in who say, Doc, look, nothing personal, but I had such a bad experience when I was a child that it was so horrible. And they're sitting there, and obviously it's taken a lot of courage for them to even get seated because their hands are sweaty and they're visibly shaking.
But, I mean, in everyday life, we all see these massive leaps that everybody's made in science and medicine.
That's
and
right.
Dentistry is out there, in some cases, way ahead of everybody else.
Well, we've made a lot of leaps.
Yeah. Just in the last couple of years.
Well, in the last few years, absolutely true. And what we know now is that your teeth are so important to your health overall that it's absolutely silly to ignore it. And to think that the mouth isn't connected to the rest of the body, well, come on. This is all part of one unit here. And so if you ignore this part, you're asking for trouble in other places, and we have studies that show that to be true. The thing is that technology we have today with dental implants, with plastic surgery for your gums to reposition things, with ability to rebuild bites, with orthodontic treatment, with all the things that we have now that we didn't used to have. We couldn't solve problems. Now we can solve problems that before were impossible to solve.
All right, speaking of before, you always have a good before and after for us. And we're going to take a look at one of those right now.
Yes.
And look at the difference in this lady. Now, her before smile, she is smiling there. It looks a little forced, though.
Yeah.
But that after one, she's a happy girl.
Yeah. Well, this lady had come to us from a couple of hours away. We have a lot of people that come from that far away. And she didn't like the way she looked, and she was having a very difficult time with functioning. We rebuilt her smile, and did enough dentistry for her that now that she can chew, because some people can't even chew at all, and now look at her face. You can tell how much happier she is. So it's almost a personality release when this happens.
All right, so the key message, I guess, today is it's not too late, and trust me, you will not be the worst case that Dr. Martin's ever seen.
That's right.
If you do, we'll get a special prize for you, but not so. Thank you, sir.